My name is Mr. El Chitumba, specialist ultrasonographer, clinical ultrasonographer. In this video, I am going to talk about Peyronie's disease, and I'm going to give you a simple ultrasound report of Peyronie's disease. So you can see here, that's the penis in transverse section, and you can see here on the albuginia here, these calcifications casting posterior shadows here. So you can see the tunica albuginia of the testicle. Yes, the calcifications here. So these calcifications, when you see them on ultrasound scan, you must already start to think of a condition which is called Peyronie's disease. So you know that the muscle of the penis doesn't have bone, it doesn't have calcifications. So when calcifications like these ones, they start to form, this transformation is in keeping with a condition that we refer to as Peyronie's disease. So you're just doing your testicular ultrasound scan, and then you come across or you find these calcifications, you have made a diagnosis of Peyronie's disease. So you can see here a longitudinal section in the tunica albuginia. You can see the calcification going all the way, and here the penile tissue is normal there, and then you can see this calcification is echogenic and is casting distal shadows there. This is a calcification. So I think you can appreciate what we are seeing here. The other thing that might also present likewise is a foreign body. So the history of the patient is pertinent for you to see if it's a calcification that is developing de novo in the penis, or is induced by trauma from a foreign body. So again, you can see another plaque there, calcification here in the substance of the penis with distal shadows like that. So this is the normal blood flow of the penis. You can see the waveform there, So let me talk about a typical or sample report that you have to write when you see a person presenting with Peyronie's disease. So when you see those multiple calcifications, this is how you can report on them. There are fibrocalcific plaques within the dorsal surface of the penis involving the tunica albuginia. An additional dense calcific focus is seen in the right tunica albuginia. The penile septum is not involved. Arterial flow to the penis is normal. The biggest calcification measures 7.6 by 0.4 millimeters. So you can see that's how you write a sample report for a Peyronie's disease. You can localize the calcifications. After localizing them, then also give a measurement. This 0 is a mistake, so it's not there. So the measurement just 7.6 millimeters by 0.4 millimeters. That's the normal measurement of the calcification there. So at times it's not necessary for you to give voluminous reports to your referring clinicians. They do a lot of work, they'll be so much tired, and they might never read any or parts of the report. So it's necessary for you to summarize the major findings and give a short but brief and detailed report like this. There are fibrocalcific plaques within the dorsal surface of the penis involving the tunica albuginea. An additional dense calcific focus is seen in the right tunica albuginea. The penile septum is not involved. Arterial flow to the penis is normal. The biggest calcification measures 7.6 millimeters by 0.4 millimeters. You are done. And you go on to give your impression or the comment. Findings are in keeping with Peyronie's disease. Regards. You are done. So you can see how summarized in simple my report is like. So I need you also to develop a culture of giving reports which are to the point. Do not write compositions or textbooks. I've seen people writing 2 pages of reports of something that is very normal. It's not necessary. It's not worth the while. So let me briefly describe to you what Peyronie's disease is all about, so that you can maybe make an appreciation of what it is. So Peyronie's disease basically is a disease that affects the penis, and we are talking about penile ultrasound here. So Peyronie's disease is a condition in which scar tissue or plaques, the calcification that I'm talking about, forms in your penis, and it causes to bend, curve, or lose length or width, which is the circumference. You may be able to feel the scar tissue through your skin if you palpate, or you may have pain in a specific part of your penis as the scar tissue forms. When you have an erection, your penis may bend up, down, or to the side, depending on the location of your scar. So essentially, this is what Peyronie's disease is all about. A formation of plaques, calcifications or scar in the substance of the penis, and then it can present with pain, or at times it can be palpable, at times it might come without a significant pain that you might feel. This is your penis there. Then when an erection takes place in a patient who is having the scar tissue there, you can see the scar tissue there. The scar tissue there is in keeping with the calcifications or the sclerosis that is taking place there. So this is the plaque in the tunica albuginea causing deformation of the penis. So you can see it's bending upward like that because of the calcification. So this layer of the penis there, which is duplicated on the ventral aspect, is the corpora cavernosa. So you can see the corpora cavernosa is duplicated here, this one and this one. These are the corpora cavernosa. Then you've got this single layer of muscle, which is the corpus spongiosum here, through which your urethra comes out via the corpus spongiosum. Then you can see the tissue there calcifying here in the tunica albuginea of the testicle. So this is how Peyronie's disease appears like. I think this is more like it, or this is more like enough for you to appreciate. So if you appreciate the basic anatomy of the penis, and then you can appreciate the calcifications of the plaques which are taking place there, then for you it means you are in a position to make a diagnosis of Peyronie's disease. At the same time, you can also write a report on Peyronie's disease. So I need you to build your confidence in report writing in ultrasound. So this is the hallmark of good ultrasound practice, because if you cannot communicate your findings, it means you cannot be a good practitioner and you are not valuable in any sense to the medical fraternity. Thank you once again. Thank you for your time. I hope you are enjoying our videos. If you've got any questions or any comments, feel free to type them under the comment section.